SickKids is reporting unprecedented wait times in its emergency department, saying in many cases the kids coming in could have been treated by a family doctor or a walk-in clinic. The hospital is now expanding its virtual triage tool to help guide parents and ease the crowds.
From what I can tell, our seasonal volumes are the highest they've ever been in recorded history in terms of how many patients per day we are seeing in May.
The children coming in without urgent needs are now waiting 3 to 4 times longer to see a doctor in the emergency department, and it's not believed to be COVID-driven. A few factors likely behind these unprecedented wait times include a rampant and rare springtime cold and flu season and less in-person access to primary care.
I think since the raising of public health restrictions a few months ago, all the kind of regular kid bugs have come back with a vengeance.
In some cases, our kids just showing up and they need their ears checked, their chest checked, and maybe just some antibiotics prescribed type of thing, when that could have been done at a walk-in or by a family doctor.
A lot of times families are telling us that they're not able to book their appointment with their regular doctor quickly, or that they're not open or things of that nature.
According to the Ministry of Health, 40% of doctors' appointments in Ontario are still virtual visits. And under the new physician services agreement with the province, doctors can bill OHIP the same amount of money they would bill for an in-person visit when they provide care by a video platform. SickKids Hospital is now expanding its virtual urgent care so more parents have access to the online tool. Dr. Dan Rosenfield tells me this will allow parents to triage their own children by using the symptom checker.
Here's a symptom checker I was alluding to. So you're going to say, what's your primary concern? So let's say you think your kid's having an allergic reaction. You'll choose that one. And then you're going to get a kind of a laundry list of secondary symptoms. So if your kid has an allergic reaction and has swelling to the face or lips, you would then click submit. So they'll be either told you need to go to the emergency department right now, you can see your family doctor, or you may be eligible for a virtual visit with a provider like myself, one of the emergency physicians from SickKids.
Obviously, virtual medicine is here to stay, but are we at a point where we need to strike a better balance?
You know, that's a great question. I think like anything that kind of comes out of nowhere, like the explosion in virtual care, there's a balance on both sides. There's certainly we know the data is clear that there are lots of families that love the services and they have done great things to keep kids out of the emergency department. And the flip side is, you know, if you just talk to someone on the phone for a few seconds, you're probably not going to have as robust an assessment. And so I think all families, all providers are really trying to navigate that balance. And we're just really trying to figure out which kids get served by each modality the best.
Now, if you'd like to familiarize yourself with the virtual urgent care tool, you can find the link and more details on our website, citynews.ca.